ASAIPA, assisting its members every step of the way. Good morning everyone. So today we have Dr. Pillay, our CEO, joining us today, and we would like to speak on some topics, some relevant topics with regards to the vaccines. So Doctor, we are going to start off. Thank you for joining us here today. I think it's also to get Doctor sit down for a few minutes. It's difficult, but we are lucky to have Doctor here. So just some questions that came from our members is, what is the current process? If you want to register, can you just walk in at the facility, or what's the current process to register?
So the registration of the vaccines is definitely still age related. So the 1st of September will be where we open up to all the age groups from 18 plus. But currently, if you are registered and you're on the EVDS system, you can walk in to a lot of both the private and the public sites. It is preference to even wait and see if you can make an appointment. A lot of the funders like Discovery Health, MedScheme, Momentum, you can actually book at their sites, and they have portals where you can just register and book. So it's quite an easy process at the moment. You don't have to wait. If you're not getting your SMS, don't wait. Either go to a site directly and walk in, or go via one of the booking systems.
Yeah. And Doctor, on that, other questions that we also received from our members is that do they receive a card after vaccination? Are they going to get something electronic?
Yes, so that's a little bit of a complication at the moment. So every person that gets vaccinated will receive a card. That card is very important, and that's your proof of vaccination. The actual certificate, the digital certificate, there's a lot of discussions happening at the moment at national level. So government will, once it's actually an international level. So once internationally they've come up with standards on what this electronic certificate is going to look like, then we will then start making it available for everyone who's been vaccinated. So we will get an electronic certificate which you could use for travel purposes. But at the moment, the card is what you need to have.
Okay. Doctor, other question also from our members is that if they have received their first vaccination on their Pfizer, do they need to wait for a notification to go to a site to get their second vaccine, or can they also then walk in if they are above 35?
So the most important thing there is that you have to wait 42 days, a minimum of 42 days. You can wait more than that if need be, but a minimum of 42 days. If after 42 days you've not received an SMS, or for whatever reason the SMS is delayed, then definitely you can walk in, you can go to any site, you can book again, like we've said, on one of the funder sites or the Vaccines for Healthcare Worker site. And so it's just the most important thing is the 42 days. They won't allow you to get vaccinated before that.
Okay. And then our last question on this is, what about pregnant women that wants to be vaccinated?
So that's been a little bit of a challenge in terms of that, we've waited for data. At the moment now, both the Department of Health and the Obstetrics and Gynae societies are recommending vaccination for pregnant women. Ideally, obviously, you want to get it before you fall pregnant, if that's possible. But I think the important thing is that you are at higher risk when you are pregnant. And we do definitely recommend it in pregnancy as well as in breastfeeding.
Thank you, Doctor, for your time, and thank you for visiting ASAIPA and helping all our members also with all their questions. Please, if you have a question, contact us, and we can make sure that we get our knowledge people to answer for us. Thank you.
Thank you, Tanya.
ASAIPA, assisting its members every step of the way.